and the dيسكوژل itself. So even it happened, it's safe because it didn't create any kind of inflammation, mechanical compression. It was presented by Professor Berchon, especially in the Spanish group patients which were pressed to do the surgical treatment with big defect in the annulus, but even 5–10% it was leaked. You can control by fluoroscopy or CT scan. Fortunately, it wasn't an interaction between the neural elements and the dيسكوژل itself. And there is no other, let's say, granulation tissue which can be produced around and create any mechanical. So there is no mechanical and there is no biochemical reaction. If it's leaking, it's safe.
Second question about that. The injected volume is pretty small, but when we have a herniated disc, there is possibility to push the disc, the herniated part, in the case of high acute pressure to the canal.
Yes, so
is there any risk for increase the pressure and make an emergent?
Honestly, no, because it works differently, opposite. It's, let's say, centralized. This part of the herniation, as you know, it's mainly water in the hernia, in the sequestrated disc. So there is an opposite mechanism. So it's protecting for more herniation. It didn't increase dramatically intradistal pneumatic pressure, shrinking and centralize the water. So you mean that if we inject something inside, it's different like PLDD, yes, when we use the laser and we're using the light, yes, so there's no risk that we inject any volume of
Consider
fluids.
that we do discography, we inject a small amount of liquid over there, and there is the risk for patient feels a high intensity pain at the moment, and when we consider that there is a pushing pressure to the outside, and the pressure going high to 50, 80
yes.
millimeters of
For this procedure, they did some CAD lab test using the syringe and checked the intradiscal pressure. So dيسكوژل injection didn't increase significantly intradiscal pressure. So it's shrinking the disc and making this centralization of the rest of the water of the nucleus, but there is no risk that you can push nucleus through the defect and you can create more herniation.
Thank you very much.
Thank you. Thank you very much. Thank you.
با توجه به مشکلاتی که تو بحث پیش اومد